Hello, everybody, and welcome to another episode of Mind Matters, Navigating Head Injuries and Concussions. My name is Kylie Como. I'm your host today. I'm the legal nurse consultant in-house here with Shane Smith Law. And today, I'm joined again by our friend, Dr. Robert Bashik of the Concussion Center in Atlanta, Georgia. Dr. Bashik, it's great to see you.
Great to see you, Kylie, as well.
All right, thanks you. So let's dive right in. I know we've got some great content ahead. So today's topic is definitely what I would consider to be a novel topic to most folks. We've talked in previous podcasts about exercise as medicine for concussion recovery, as well as nociplastic pain as that kind of third pain disorder, both of those being very novel concepts. So Dr. Bashik, it seems like concussion care is an evolving field. Is that right?
So it really is an evolving field, and we're at the Concussion Center. We want to be at the front of that. We recently added a device called Neck Care, which is a device that you put on your head, and what it does is it looks at different aspects of the neck. It looks at the movement of the neck. It looks at sensory motor integration of the neck. It looks at the proprioceptive ability of the neck. And proprioception is where the neck is in space. And with that, we can find significant abnormalities in concussion patients that also have problems with their neck. We have 4 different cognitive examinations that we do now. We just published a paper in the journal Clinical Neuroscience, and the name of the paper is Office-Based Neurophysiologic Assessments for Diagnosis and Prognosis of Concussion. And basically, we have a device called Concussion, which really can pick up significant cognitive abnormalities in our concussion patients. We do the Buffalo Concussion Treadmill Test. We do the Buffalo Concussion Bike Test, but we recently added what's known as the Chicago Blackhawk Test. And this is really for elite athletes. It's a very strenuous physical exam that is to bring out abnormalities associated with concussion. We've started doing that. We have a CLE program coming up on March 14th, and we also have been invited to give a concussion talk at the Final Four Women's Basketball Conference in Tampa in about 6 weeks. So there's a lot going on at the Concussion Center.
Yeah, it sounds like you guys are quite busy and, bringing your vast pool of expertise, you and your colleagues, to the, still relatively unknown world of brain health and concussion treatment is going to be very impactful, I'm sure. Thanks for sharing that. I hope some of our listeners can kind of tap into some of those if they're able to. So let's dive in. Let's get into some deeper waters here. Hippocampal neurogenesis, right? So that's a term that I'd say most of our audience is probably not familiar with. So could you please just kind of expand on that for our viewers?
We have always been taught, I remember when I was in medical school and even in my neurology residency, that you have the brain, you have all these billions of neurons, and they're basically formed by the time you're a small child, and then that's it. There are no more neurons that develop. And obviously, as we get older, you tend to lose some of these neurons. Well, we have found out that is a totally inaccurate concept, and that we actually do form new neurons as an adult every single day. And this is really how we learn today. And that's what this whole talk is about.
You kind of answered my next question as far as, that neural development. Yeah, that's been kind of hard and fast for a while, but you got what you got, right? But not so much the case. So what's the significance of that word adult then? What does that mean to everybody?
Again, basically what that means is, as an adult, you and I both, as we're sitting here today, we are going to produce these new neurons in our brain. And as we get into the talk, I'm going to tell you things that help stimulate these neurons. And I hope today, Kylie, for you, that you have significant adult hippocampal neurogenesis, and I hope to teach you guys a lot of stuff today about this. And the learning, we know that learning stimulates hippocampal neurogenesis, as well as some other very important activities that we want to continue throughout our lifetime.
Fantastic. Well, hey, your mouth to God's ears. I can feel my brain getting bigger already. So I'm ready for it. Let's hear what you got.
All right, if we can start the presentation. So today, what I'd like to talk about is the link between hippocampal neurogenesis, concussion, brain fog, and depression. So what I'd like to do before we get into this link, I want to have a brief review of concussion. So this is the definition of concussion through the Concussion in Sport group. This is an international conference that happens every 4 years. The last one was in Amsterdam in October of 2022. And their definition of concussion, and I really think this is the best definition. Concussion is a traumatic brain injury caused by a direct blow to the head, neck, or body, resulting in an impulsive force being transmitted to the brain. This initiates a neurotransmitter and metabolic cascade with possible axonal injury, blood flow change, and inflammation affecting the brain. Symptoms and signs may present immediately or evolve over minutes to hours and commonly resolve within days, but may be prolonged. And I just want to emphasize that a concussion can be caused by a direct blow to the head. Everybody knows that, but it also can be due to a direct blow to the neck or the body. So the concussion metabolic cascade, so basically what happens after someone has some sort of traumatic event, there is this sudden neuronal firing or depolarization. This is the excitation that occurs for seconds to minutes right after the trauma. This is followed by neuronal depression, which will last for several weeks. This sudden neuronal firing causes this electrical chaos where this person sees stars, has loss of consciousness, they stumble, they look dumbfounded, and then this is followed by the spreading depression. And as a result of this depression, you get what's known as an energy crisis. There's a 20% drop in ATP production in the brain, and it takes the brain about 3 to 6 weeks to recover. When this happens, there is collapse of the neuronal microstructure. The axons can be damaged. This often will result in neuroinflammation, disruption of what's known as the blood-brain barrier, and all of this is basically not visible. You can't see this on a CAT scan or an MRI, and that's why they're always negative. So just to go over a little bit more, there's the neuronal excitation, again, which lasts for seconds to minutes, and that is the result of something called glutamate influx. The neuronal depression is the result of calcium influx into the cells, and we're going to come back to both of these when we get into hippocampal neurogenesis. As a result of the glutamate and calcium, mitochondria are damaged, a 20% drop in ATP, and 3 to 6 weeks for these mitochondria to heal. With concussion, you get what's known as autonomic nervous system dysfunction, and that causes a lot of symptoms, and we're going to go over that in just a second, but you also get neuroinflammation. So with autonomic nervous system dysfunction, you have what's called excess sympathetic activity, and this is why the person will get headaches and insomnia and dizziness, anxiety, cognitive difficulty due to disruption of hippocampal neurogenesis. With neuroinflammation, you get activation of something called the microglia, and they're very inflammatory. Think about when you get a cut on your finger. It gets red and it's swollen. That's the inflammation that goes on, and then after a few days, that inflammation turns off because the inflammatory response has gotten rid of all of the tissue that's been injured and allows it to heal. Another thing that happens with neuroinflammation is something called lymphatic dysfunction. And this is the cleanup crew in the brain, okay? Your lymphatic system helps get rid of all of the stuff that needs to be removed from the brain that occurs during the day, and it gets rid of it mainly at night. And when you have microglial activation, when you have lymphatic dysfunction, this can cause disruption of hippocampal neurogenesis. So adult hippocampal neurogenesis, this is the development of new nerve cells that occur every day in the adult human brain. This is a new concept, but actually it's not. It's actually it's been around since the 1960s, but it's just recently been brought to the forefront for clinical understanding. And basically what happens is there are neural stem cells in the hippocampus of the human brain that produce new cells every day. So the hippocampus, everybody kind of remembers the hippocampus with memory, and people talk about it with Alzheimer's, but it is deep within the temporal lobe. So there's a picture of it. Kind of looks like a sausage, actually. Okay. Hippocampus actually means a seahorse. Here's another picture of the hippocampus. You'll see it kind of in orange there, right in the middle. And if you take a slice of that hippocampus, you can see kind of how it looks like a seahorse there. But the very dark part, the dark blue there, where it says dentate gyrus, right in the middle, this is where these new cells occur every single day. The hippocampus is critical for learning, memory, and emotion. Emotional responses are organized in the hippocampus. Recollection of past experiences and imagining the future, spatial navigation, pattern recognition, encoding memories. So when you've been to a restaurant, you really enjoyed it, and you want to go back to it. So that is a past experience, and you're kind of imagining the future. You're looking forward to that. That's all in the hippocampus. Spatial navigation is, when you drive home today, you know how to get there. You remember what road to go. And even if there's some sort of blockage, the road's blocked, you can figure out how to go around that and get where you need to go. Pattern recognition is, again, when you're driving home, you see a sedan in front of you and a truck to your left. That's pattern recognition. You can separate a fork from a spoon. And then encoding memories, there's different types of memories that you encode. There can be visual, there can be auditory or semantic memories that you, when you see something, that's visual encoding. When you hear something, when you recognize somebody's voice, that's acoustic encoding. And semantic is just this lecture that we're doing today. I hope you guys remember this. That would be semantic encoding. So the dentate gyrus is part of the hippocampus, and this is where these neural stem cells are located, and this is where neurogenesis occurs. So there are about 700 new cells that are made every day, all of our life. Now that will decrease some as we get older or if there's been some sort of trauma, but generally there's about 700 new cells made each day as an adult, and this is how we learn. So when you read a book, when you watch a movie and you remember it, these new cells, they're the ones doing the job. So if these new cells are being formed, that means there are some old cells that are dying. These new cells, they are primed. They are really active. They are focused. Think about, when you see a child, their brain is like a sponge. They just learn and learn and learn. And this is the absorbent mind. So these new cells are so focused on learning, and the more you learn, the more you do new things, it gets these cells even more active. So the hippocampal cells and the dentate gyrus, they're very plastic, which means they can be molded or shaped, and they are very vulnerable to injury such as concussion. So learning and exercise stimulate the production of these new cells. Just think about that for a second. When you learn something, when you go work out at the gym, you are stimulating hippocampal neurogenesis. We're having a lecture that most people are not familiar with. Anything you learn today, you're stimulating that dentate gyrus to make these new cells. So the neurogenesis, or the production of new cells in the dentate gyrus of the hippocampus, can be reduced if there's damage. So for example, a stroke, a traumatic brain injury. And if you remember, concussion is a mild traumatic brain injury, but there's also a moderate and severe traumatic brain injury that can damage the hippocampus. Neuroinflammation can damage the hippocampus, the dentate gyrus. Aging, think Alzheimer's disease. As you get older, those cells in the dentate gyrus, you may not have the 700. It can get less and less, and that can interfere with that person's memory. And everybody remembers, has probably heard of chemo brain. You get chemotherapy and then you have these cognitive problems afterwards. Well, most likely this chemo brain is the result of the chemotherapy damaging these very sensitive cells in the dentate gyrus. So these new neurons are needed for learning and memory, but now there's been an injury, and this results in damage to the hippocampus, resulting in injury and possibly death to some of the new neurons. It just depends on the severity of the injury. So depending on how much damage is done to the hippocampus and the time necessary for these injured neurons to recover, and some may not recover, this can result in difficulty with learning, memory, and emotion. Well, that's what I think brain fog is. If you see these people who have had a concussion and they have this brain fog and it lasts for several weeks or several months, I think it's the result of damage to this dentate gyrus and the production of these new cells that are needed for learning and memory. And then think about depression for a second. There is a neurogenesis hypothesis for depression. And basically this theory proposes that impaired neurogenesis in the hippocampus is a key factor in the development of depression, because new neurons are important for plasticity, to be molded, and the adaptation to stress.
Well, that's going to do it for another episode of Mind Matters, Navigating Head Injuries and Concussions. And again, I would like to extend our gratitude to Dr. Robert Bashik with the Concussion Center for joining us today and sharing his vast, expansive knowledge and expertise with us all. I hope that our audience has enjoyed being a part of this fascinating discussion as much as I have, and is walking away with a deeper understanding of hippocampal neurogenesis and all things brain injury related. So please don't forget to hit that like and subscribe button to keep up with our channel and our latest and greatest content. And then please leave us a comment on our page to let us know what you thought of today's discussion. And as always, remember, if you're in pain, call Shane at 980-999-9999. See you next time.
In pain, so I call Shane. 980-999-9999. In pain, call Shane.